Hello everyone, it's Dr. Bang here again, sharing some tips with you for those who might be suffering with neck pain or mid-back tightness, chest tightness, some radicular pain down the arms, and IT band tightness. Let's get started. So as you're sitting up straight, I'm going to bring your ear to your shoulder and just go through a range of motion. Follow along with me so that we can do this whole protocol, and you can just, every time you watch the video, you just follow me as we're doing it. You should be doing this twice a day. It should hopefully take you about 5 to 7 minutes. As you can see, I'm trying to hit my end ranges of motion in my neck. This is a good warm-up to make sure all the muscles are moving nicely. You can do 3 each direction. Good. Come back up to center. We're going to hit 2 specific muscles, upper trapezius and another one in the back called the levator scapula. We're going to do it as we do some trigger point work throughout the muscle. Trigger point work is just deep pressure on areas that hurt in the muscle while you hold them. So first, let's do this right upper trap. Bring your left ear to your shoulder. You start to feel a nice stretch. Take your right hand and you're going to get some deep pressure into the trapezius. You feel, oh, it's tender. Give yourself some moderate pressure here and hold this. We're now going to add some resistance through the muscle to help it relax more. We're going to do that by pushing our head to the right, and our left hand is going to hold that position. So you can see I'm trying to push my head to the right. My left hand's holding my head here, and I'm going to count to 20. And then you're going to relax and let gravity take you a little further into the stretch. And push again. I'm still maintaining this downward pressure here on the trap while I'm stretching. And when you get to about 20, you're going to relax a little bit more. Woo! Resist and push up again. This should hurt in the mild to moderate range. It should not go to moderate to severe. If it does, you just need to back off a little bit. Once you hit your 20 seconds here, keep your right hand in position, and now turn and look left. You should feel the stretch kind of change, and you're going to reposition your hand onto where the most painful spot is and push down. Now I'm going to lift my head backwards and push into my hand here. Once you get to 20, you're going to relax and go a little deeper into the stretch. Lift up. I kind of count to 20 fast, so you might need to slow down. Or just follow me, it's fine. Relax one last time. I'm trying not to pull with my left hand. I'm just using it as a wall to push against. Good. Now you'll start to feel this side feels tighter than this side. This side feels like relaxed. So we're going to copy, right? So first, go looking straight forward, drop your head to the right. Fish around, you're like, oh man, that sucker's so sore. That's your spot. Push down, resist up, hold for 20. And relax. Let gravity take you deeper into the stretch. And hold up. And relax. Really pushing here, and lift up and hold. Your resistance or your pushing should also be in that mild to moderate force to help the muscles to really relax. Once we've hit our 3rd repetition, keep your hand here, look down to the right, you'll feel the stretch change. Reposition this hand now. Really find that, oh, there it is. Find that spot. It's going to vary a little bit. And this is stretching the levator scapula. I'm going to be pushing my head backwards this way. And relax. Lift up. Good. Awesome. So we started to loosen up the neck muscles, the traps, the levator scapula. Now this specific patient had some discomfort down the left arm, tingling, numbness, a weird feeling. So we're going to work on that shoulder blade because there's a lot of nerves that go from our neck into our shoulder blade down our arm. We've already worked the neck portion of those nerves. Let's work this scapular portion. First, we're going to do some scapular range of motion by kind of moving the shoulders forward, up, back, down, and then backwards. Up, forward, down. As you do this a few times, I really want you to try to push the edge so it almost feels like your muscles are cramping. That's good. We're working through these motions and these areas of the range of motion we don't often work. Okay? We've done that 3 times. Now, depending on what arm hurts for you, do these exercises next. So for this patient, it's his left, pushing back, far as you can go, forward, far as you can go. This part's staying in position, it's just pivoting. And now what we want to do is we want to add some resistance. So the best way to do that is using the ground. So let's do resistance going backwards first. You're going to lay back, arm in this position, and you're trying to push the palm or the back side of your hand into the ground. And you're going to hold for 20. It almost feels like it's cramping. You're going to do what's called riding the cramp. You're going to push, and if it starts to cramp, you ease off just a little bit. If it feels better, you push a little harder until you feel that cramp trying to come on, and you ease off just a little bit, and ride that for the full 20 seconds. And then you can see I already rotated forward to do the other direction, pushing my palm down into the ground. And then back. Feel like the muscles really working behind the shoulder blade. That's exactly what you want to feel. A lot of this is going to happen to people who sit at a computer or sit while they drive for long periods of time in college, high school. These are all really great to do. And I'm just alternating back and forth. You can see I'm kind of shaking a little. That's good. That means you're working the muscles. Isolating the ones that are the problem and working them. Once you've hit your 3 sets there, we want to do some trigger point work on the shoulder blade. So you're going to take a foam roller or a hard ball. We're going to position it right onto that shoulder blade muscle. Lift up, and we're going to just really try to dig in the spot that might feel the most sore. You can hold your head with the one hand, kind of let this one rest in your lap or here. If I find a really tender spot, you can kind of do back and forth gently or roll like kind of that full shoulder blade area. I'm not on my mid back, I'm on my shoulder blade. If it's too painful, you can leave your butt down, just kind of wiggle back and forth like this. Or sometimes I'll even put it against the wall and lean back into it if it's too much pressure on the ground. Okay? Now, a lot of times this is accompanied with the thoracic pain. That's in your mid-back, between your shoulder blades. It's before your neck and before your low back. So we're going to start with some movement, and we're going to be doing like this range where we're just flexing the mid-back, and I'm trying to like drive my hands into the ground. I'm working it. And I'm going to almost squeeze my shoulder blades together. I'm shaking a little bit. I'm working those muscles. I'm just going to warm up these sets like this. Feel those muscles work. Hit that moderate level of exertion. Once I've done about 3 of them, it's time to use the foam roller through the mid-back. Place it about right in the middle of your mid-back. Cradle your head so you can let your neck muscles relax. Lift your butt up. You'll feel some clicking and popping. As long as it's not painful, it's fine. That's the joints of the thoracic spine. I will oftentimes put my elbows together to move my shoulder blades. And you're going to go ahead and do this for about 30 seconds. You don't want to roll on the mid-back because that's going to hurt. You can see my shirt's getting in the way. You can sometimes tuck it in. If you have long hair, you're going to want to grab your hair here or put a headband on. If you feel some specific areas, like let's say it's more sore on the left, you can lean up to the left or lean to the right and isolate those painful areas. My shirt again. Once we've rolled for about 30 to 45 seconds, we're going to do some like slow stretches. So I'm going to start here. I'm going to drop my buttocks down and drop my head and just stretch through the thoracic spine. And go up a little bit. Just kind of keep working my way up. You'll feel it in the chest as well. That's good. Those ribs connect all the way around into the front. So if your mid-back's tight, likely so is your chest. Once I've stretched that way, I'm going to do this. I'm going to turn the foam roller. Try to let my chest open. Maybe I'll do this and try to force my chest up. Sometimes it feels good to kind of go back and forth here. You can put your elbows down so you don't feel like you're going to fly off of it. Extending your arms also feels like this part of the muscle is being stretched. I'd spend about 60 seconds, 30, 60 seconds there. Last of all, the patient was talking about IT band tightness. This can affect your low back, it can hurt your knee, it can hurt your hip. My favorite stretch to do is get a strap. It doesn't have to be a yoga strap. It could be a belt, a piece of rope, whatever. Hook the bottom of your foot. You're going to come up, but then you're going to go this way, like across your body, and you should feel it kind of like here. Once you start to feel it there, you're going to see I'm going to take my arm holding the rope away from my body, and I'm going to try to resist by pushing my leg this way, and I'm holding here, not letting my leg move. That deepens the stretch and allows us to relax the IT band. And same thing, we do that 20-second kind of stint. Once I've hit 20, I'm trying to let gravity take me further into the stretch, and then I'm going to resist again. Push, give it a good one. Severe pain is not good. Ease off a little bit. Burning pain, ease off just a little bit. You'll get more flexible as you do this. Remember, twice a day, try that for 7 days. If that doesn't seem to work or start to help, you need to revisit, contact your physician, chiropractor, physical therapist, and ask for other suggestions. Do one more time. And typically, if one IT band is tight, they both are. Okay? So I just switch feet. I'm across. I really feel it there. And I'm holding the band and I'm pushing this way. Shaking's fine. That's just conditioning your muscles because it's not used to doing this motion. In fact, if you shake a lot, that tells you you're just not used to using it. And that will set you up to get injured faster if in the event you slip or fall and you need that muscle. It's not trained. So shaking a lot tells you, I got to spend some time training that muscle. So you might look into other exercises to strengthen those specific muscles you're utilizing when you're shaking a lot. And finish my third set. I want to thank you for joining me today. Make sure to check out the rest of the videos we have to give you more suggestions on what you can do to manage your symptoms and give you things to try at home on your own. Thank you so much and be well.